Chemotherapy takes an immense toll on the body, not just in targeting cancer cells, but in affecting nearly every system responsible for appetite, digestion, energy, and nutrient absorption. While medications fight the disease, patients are often left battling nausea, fatigue, altered taste, diarrhea, constipation, dry mouth, and a profound loss of appetite. In this context, nutrition becomes more than just a matter of eating well. It becomes a critical component of care. Maintaining nutritional status during chemotherapy is not optional. It directly affects treatment tolerance, recovery time, immune resilience, and, ultimately, survival. But not all strategies are equally effective, and some well-intentioned choices can backfire if not carefully managed. First, the fundamentals. When undergoing chemotherapy, the body's need for nutrients often increases while the ability to consume or absorb them decreases. Protein is especially vital, necessary for preserving muscle mass, healing damaged tissues, and supporting immune cells. Yet it is frequently underconsumed due to taste aversions or digestive discomfort. Small, frequent meals that include soft proteins, like eggs, yogurt, tofu, or well-cooked legumes, often work better than large servings of meat, which may feel heavy or metallic. Adding high-calorie, high-protein snacks and drinks between meals can also help prevent weight loss, especially in patients with reduced appetite. Managing side effects becomes a delicate balancing act. Nausea and vomiting are common but often unpredictable. Eating bland, cold, or room temperature foods, avoiding strong smells, and staying upright after meals can reduce symptoms. Ginger, whether in tea or lozenges, may help mild nausea, though it should not replace prescribed antiemetics. Fatigue, another near-universal symptom, often reduces the motivation to shop, cook, or eat, making pre-prepared nutrient-dense meals a lifeline. Taste changes can be particularly distressing. Meat may taste bitter or metallic, while sweet flavors may become overpowering. Using plastic utensils instead of metal, marinating proteins in citrus, or focusing on high-umami plant-based foods like mushrooms and miso can help restore some eating enjoyment. Hydration is often overlooked but critically important. Chemotherapy can lead to dehydration through vomiting, diarrhea, or reduced fluid intake, and even mild dehydration can worsen fatigue and reduce the effectiveness of medications. Sipping on electrolyte-rich fluids, broths, diluted fruit juices, or oral rehydration solutions throughout the day is often more effective than chugging water in large amounts. Signs of dehydration, such as dark urine, dizziness, or dry mouth, should never be ignored. Despite best efforts, some patients cannot maintain adequate intake. This is when clinical nutrition support becomes essential. Enteral nutrition, feeding through a tube into the stomach or small intestine, is often the first step if oral intake is no longer sufficient, but the gut is still functional. It allows for tailored nutrition that meets the patient's calorie, protein, and micronutrient needs without the strain of eating. It's especially helpful for patients with head and neck cancers, gastrointestinal blockages, or severe mucositis. Contrary to stigma, feeding tubes are not a sign of giving up, they are a tool to preserve strength and treatment options. When the gastrointestinal tract cannot be used, due to obstruction, severe damage, or surgical removal, parenteral nutrition intravenous feeding may be necessary. This method bypasses the gut entirely, delivering nutrients directly into the bloodstream. While life-saving, parenteral nutrition comes with higher risks, including infection, liver dysfunction, and metabolic complications. It should always be used with careful monitoring and as a last resort when enteral feeding is not feasible. Importantly, neither enteral nor parenteral nutrition is meant to replace treatment. They are supportive, not curative, but their use can be the difference between continuing therapy or being forced to stop due to malnutrition. It's also critical to avoid harmful approaches. Extreme diets, juice cleanses, or fasting protocols marketed as natural cancer therapies can be disastrous during chemotherapy. These methods often lead to rapid weight loss, nutrient deficiencies, and immune suppression, all of which directly threaten treatment success. Even well-meaning restrictions, like cutting out dairy or gluten without a diagnosed intolerance, can reduce dietary variety and lead to unintended nutrient gaps. Nutrition during chemotherapy should never be based on internet trends. It should be guided by evidence and tailored to the patient's evolving condition. The role of the oncology dietitian cannot be overstated. These professionals are trained to adapt meal plans around side effects, lab values, and treatment schedules. They can help patients navigate everything from appetite loss to managing glucose levels during steroid treatment to balancing supplements with prescribed drugs. Too often, nutrition is treated as an afterthought in cancer care, but it is foundational. Without it, even the most advanced therapies struggle to succeed. In short, what works during chemotherapy is not perfection, it's practicality, personalization, and prevention of decline. The goal is to maintain weight, preserve muscle mass, and support immune function so the body can withstand the stress of treatment. This may look different from patient to patient, and it often requires adjustments as treatment progresses. But one thing is clear: when nutrition is ignored, outcomes suffer. And when it's prioritized, patients are better equipped to fight, to heal, and to endure.